So welcome once again to all the participants. Thank you for taking time out and joining us in an afternoon. For those of you who are from India, very good afternoon. And we have many participants joining from other countries. So very happy to share with you that we had almost 1,300 interests and registrations, and members who have registered are not just from India, 28 states of India, but from almost 19 countries. So this just goes to prove the importance of this particular topic and how this topic is of prime importance across the globe, and how this has become even more pronounced in the light of COVID, where the importance of hand wash with soap is really our only defense against the spread of the virus. It's also very heartening to see that almost 35% of the participants are practitioners. And when I say practitioners, I mean those who are directly related to administration. This does not include all the members of working with NGOs and corporates, etc. So this is really a fantastic community of practice. And we hope that this seminar, which is only the first in the series of webinars, will proceed to more different platforms and different patterns of communication, and where we can all collaborate and work towards this common agenda. So to quickly put this, the objective of this webinar is very focused. We're here to discuss and identify the different suitable hand wash station models that can be implemented quickly in schools by the government and by other entities. I was just seeing the chat room just before the beginning of the program, and many members are saying that we have just about a month or two before the schools reopen. And this is the time really when we need to finalize on our strategy and quickly develop our implementation partners and implementation plan. So while COVID really is, and management of COVID response in schools is both a hardware and software issue, and we will discuss some aspects of it, but this webinar will be largely focused on discussing hardware and how do we get this infrastructure implemented in schools. So a quick snapshot of today's panelists with us. I'm Dr. Malini. I work with an organization called Administrative Staff College of India. We, along with our partner Center for Innovations in Public Systems, are very happy to put this webinar together. I'm supported by my colleague, Dr. Priyanka, and we will be taking you through and handling today's session. I welcome Dr. Pratibha Singh, a very senior practitioner, a wash specialist from UNICEF, who will be bringing the different models which are being implemented in India currently and the experiences thereof. I welcome Dr. Bella, who's again a global specialist in wash in schools, and she's a senior advisor in GIZ, and she would be bringing us some global models that she has been personally involved in, particularly in Philippines and African countries and elsewhere. I welcome Mr. Neliappan. He's the Nodal Officer of WASH from the Directorate of School Education, Nagaland, and he brings us the government perspective as to what are the challenges, because it's a no-brainer that all schools should have hand wash stations with soap. Then why is it that governments are unable to do that? So he will bring us that perspective and help us understand, so that all the other members, all the other stakeholders can find out how best one can collaborate to achieve this common goal. I welcome Professor Srinivas Chari, my senior colleague at ASCI, a renowned professional globally in the water sanitation sector, and someone who has anchored Wash in Schools program and taken it to the ministry at the national level and various state levels, and works with corporates on taking this agenda forward. I also welcome Dr. Harsh Sharma, who is the Director of Center for Innovations in Public Systems. He's also a professor at ASCI, and he is deeply involved in SDGs and scaling up of innovations in different states in India. So welcome to all the panelists, and just a brief snapshot. So a couple of clarifications, because we receive these often. First and foremost, PPT will be shared with all the participants. The webinar is being recorded. It will be shared with all of you. In the chat, please use it for sending any questions and any comments. And at the bottom of the chat, you would find options. We request you to select the panelist and participant option so that everyone can view your questions. It is right now at the panelists. I think that's the default setting. Then the questions are seen only by the panelists. So please use the panelists and participants option. Any additional materials that you need, kindly request and we will send it to you. There is a website which is given, and this is also sort of a launch of our website today. This has been developed to sort of promote Wash in Schools program. So please use it extensively. All these materials will also be uploaded on the website. So quickly to take you through, ASCI is an organization established in 1956. We are registered as a society. We have several areas of excellence, and you can find more details on our website. We have deep experience and expertise in the area of water sanitation in schools, and you can see the kind of service portfolio that we have, ranging from baseline studies to the benchmarking program, to work in menstrual hygiene management, to even crowdsourcing ideas and funds. So this is a whole gamut of activities that we're involved in. Happy to connect with you later on for anything that you'd like to work on. We'd also like to specifically mention that we are constantly keeping an eye on how the water sanitation in schools is developing in India over time. This particular program that you see on the screen right now is something that ASCI has been working in partnership with UNICEF, where we are tracking the progress on a year-on-year basis. This information is just a snapshot. We have a lot of information for data collected from about 5.5 lakh schools in India. So quickly coming, as I mentioned earlier, the simple process of hand washing with soap really is our best defense, and children being the most vulnerable, schools have the potential to become a node of virus spread if this particular task is not addressed immediately. So 15.3 lakh schools, that's 1.53 million schools with 253 million students studying. This is a huge challenge, and this is something that collectively we need to address. So national data and other data would tell us that more than 90% of the schools in India have hand wash facilities. But it's important to understand what is the meaning of that data. For example, a school which has a hand pump or one tap, it would be technically right for the school to say that, yes, we have provisioned hand wash facility. But the question to ask really that, are we meeting the goal of hand wash with soap by all students in a particular school and in all schools? So having one tap or a hand pump will not suffice in meeting this particular goal, particularly in the context of COVID response, where we need to have frequent hand wash and by all students at critical times of before meals, immediately after toilet use, and after all other periods where your hands may get unhygienic. So quickly, less than 30% of the schools in India claim to have a hand wash facility with soap before midday meals by 100% of the students. That means even by self-admittance, more than 70% of schools are in need. That's more than 70% of the 1.5 million schools are in need for hand wash infrastructure. Of course, water and soap are related issues. So therefore, some of the 2-3 questions that I'd like to park with you before I hand over the mantle is, is the water source a limiting factor? For example, do we really need running water? If we don't have running water, as is the case in many schools in the country where they're dependent on board wells, then how do we facilitate the process of group hand washing or hand washing by all these students? What is the infrastructure? What are the models which are available? We may have a fantastic facility, but it might not meet the number. So great facilities, but does it meet the norms? So what are the norms? What are the national norms? What are the international norms to ensure that we have hand wash facilities in the school? We may have some design, but is that design child friendly? Is it at a height which is accessible? Are we maintaining it well? So these are some of the challenges that we are all grappling with. And revisiting the objective with all of you, what we really need currently is innovative and cost-effective, affordable solutions that are equitable. That means they can work in water scarce conditions, they can work in conditions where water is unreliable, in rural, urban contexts. We need solutions which are quick to implement, easy to implement, and equally easy to maintain and use. We need to see that these facilities help us comply with the COVID-19 requirements, for example, social distancing requirements, frequency of hand wash requirements, and all this put together should help us achieve the goal that all students are able to wash their hands at all the critical points of time. Now, with this, I'd like to call upon our first speaker, Dr. Pratibha, to present her experience and share her experience with all of you. Thank you.
Hello. Hello. Yeah, am I audible to everyone?
Yes, Dr. Pratibha.
Yeah. Thank you so much, Dr. Malini. Really very good afternoon to all the participants. And thanks so much for taking out time to join today's webinar. May I have the next slide, please? Next slide, please.
I place the next slide, Dr. Pratibha.
Yeah. So I had just have a very short presentation and would like to keep it as participatory as the virtual modality allows. So just to briefly take you through the journey of the whole Wash in Schools program in India and also the hand hygiene part of the Wash in School program. So the journey started in the 1990s with the hygiene and sanitation program under the CRC, the Convention of International Rights for Children. So it was ratified by 196 countries. India was one of the signatories. And in 1994, hand washing with soap was included within the school's wash interventions with the program implementation plan, the district DPEP, district level implementation plan. And this has whole objective of improving the learning environment where hand washing was felt a very critical component of the entire learning environment because it safeguards the health of children in a big way. And then hand washing with soap has been a part of so many programs over the years. It started with the school sanitation and hygiene program of the Ministry of the Department of Drinking Water Sanitation at that time in the year 2003, and then it was incorporated in the Sarv Shiksha Abhiyan. Then the Right to Education Act was a big step for the whole hand washing with soap program in school, and also followed by that the Rashtriya Madhyamik Shiksha Abhiyan and the Swachhata Action Plan, Swachhata Puraskar. Over the years, all these programs have been prioritizing hand washing with soap. And one point to note is that the midday meal program of the government since 2013 onwards, they have focused a lot on the hand washing facilities, and in fact the fund allocation has been happening from that avenue as well. So major step was achieved with the launch of the Clean India Mission. You all may be aware that Swachh Bharat Mission was launched in 2014, and along with that the mission for clean schools was also launched. And the significant point to note over there was that CSR resources were roped in order to make things a reality, because resource crunch is a major hurdle when it comes to ensuring hand washing facilities in all schools. And the year 2015 was a milestone for hand washing with soap in school because the SDG goals incorporated this aspect. And in 2016, the government of India took a very innovative decision to launch the Clean School Award, something which is globally also very well known. It's very unique because there's a system of benchmarking of schools based on the position of the condition of water and sanitation hygiene facilities, and also the behavioral practices. Followed by that, the joint monitoring program of WHO and UNICEF at the global level. In 2018, they prepared a baseline for wash in schools, and that report, UNICEF and ASCI were the key stakeholders. We helped in putting together that report, and according to that, 54% of the schools in the country had a basic facility with water and soap. In the year 2018, the Swachhata Action Plan was launched, and hand washing with soap was an integral part of the Swachhata Action Plan, because it was very significant, because early prior to that, funding for the Swachhata Action Plan, which includes the hand washing with school component, was not very much there. It was very minuscule. But 2018 onwards, under the Samagra Siksha, or the consolidated school the consolidated, the Samagra Siksha, or the consolidated school education campaign of India, the funding was put in place for the wash and school component that had a major emphasis on hand washing with soap. Next slide, please. Yeah. So just to discuss briefly some of the norms for a normal emergency situation, like since now coronavirus has posed a new scenario for all of us to respond, and schools are no exception. But the existing norms are as per wash and school component of the program, 1 point of hand washing was supposed to be effective enough for 10 to 12 students, and as per the National Building Code, the NBC that you see over here in the slide, 1 point for every 60 boys and 1 point for every 40 girls was thought to be appropriate. And then soap tray and soap was 1 tray for every 2 wash points was thought to be appropriate for the under the school sanitation hygiene program. For the residential school, definitely there are lesser number of points, but for more number of students, because the students stay for the whole day over there. Now, during the scenario of COVID-19 pandemic, a few things to be just kept in mind. Can we have the next slide, please? During the COVID scenario, COVID pandemic, some of the key things to just ensure for teachers and students in terms of the timing of hand washing with soap are after touching surfaces of any kind, that includes paper, includes wooden surfaces, includes clothing, and also it includes the metals as well. And also when people come out, the students and teachers, they are exiting the public transportation or any building, they happen to be touching door handle, elevator door, and buttons. So after coming in contact with any kind of surfaces, hand washing has to be ensured mandatorily, and also before entering and coming out of toilets as well. So that's very essential. And similarly, it goes before and after eating, and hands have to be systematically washed after blowing nose, after coughing, and in case a tissue paper or a handkerchief is not available, it is advisable by the government also to have a folded elbow, and you can sneeze and cough on that, because the clothing that people are wearing can be actually washed. So sneezing on a folded elbow can take care of the non-availability of a handkerchief or a tissue paper also, and it can also ensure that you don't have to immediately find a trash bin and dispose of the used tissue. And now one more thing to ensure is that appropriate technique of hand washing is also very critical. And as per the global recommendations, at least hand should be washed for 20 seconds. Can we have the next slide, please? Yeah, so some of the key principles I have just outlined here. So during the present emergency situation, we have to just ensure that minimum hand touching of the hand washing point has to be there. So the water spout does not have to be touched by hand in any case, and also the soap dispenser, because hand-to-hand transmission is a major cause of concern during the coronavirus emergency. And second thing to ensure is the running water availability, because just having a hand washing station in place is not enough. Running water has to be taken care of. And then height of the hand washing platform should be accessible for all categories of children. So even it should be age sensitive, and keeping in mind the age group of students who visit a particular school, that has to be ensured. And then physical distancing is very critical, like our government has been repeatedly saying, and international recommendations also say that at least 1 to 2 meters minimum 1 meter has to be ensured in all cases. So what has to be done is that the existing hand washing stations, hand washing platform in the school can actually be retrofitted, and it can be made sure that distance between the two children who wash hands or maybe two adults who wash hand over there should be minimum 1 meters. And then one thing to be ensured is to have an accident free location, and also we can have a barrier free location as well. It should be easy to handle. The hand washing station should be cost effective, durable at least for the crisis period, and also it should be easy to transport, assemble and disassemble. Next slide please. Next slide please. Yeah, so just a few other things like a provision of soap and safety against threat, then provision of suitable disposal of the wastewater from the hand washing platform has to be ensured, because in coronavirus time even the liquid, the gray water which is getting discharged from hand washing point will be contaminated, has a chances of contamination, so adequate disposal has to be ensured. Next slide please. So next slide, we have a checklist for setting up a hand washing platform with soap during the COVID-19 pandemic. First point is to just ensure that pipes should have a adequate slope for uniform water discharge. We mean the pipes that lead to the water sprout for washing hands. And the hand wash platform should have a proper slope for drainage. Wastewater should be drained out of a soak pit of a proper size. Then soap dispenser should be made available. And then for managing the waste, a pedal operated dustbin as much as possible should be placed nearby. These are very commonly available things in the market, so it won't be very difficult to procure at this point of time. Then hand wash basin height should be at least 2.5 to 3 meters so that it can be comfortably used, and definitely it has to be age appropriate as well. And at this point of time, like majority of schools are not reopening very soon, and if at all they reopen in the coming days after the lockdown, it might happen in the green zone. So over there, that consideration has to be considered as appropriate. Then pipelines and wash basins should be free of leakages. This is very much relevant during the present pandemic period, because the chances of transmission have to be reduced as much as possible. And the regular checkup and fixing of leakages has to be taken care of. So the school or the preschool, wherever that hand washing facility is installed, they should have a proper mechanism in place to carefully supervise the operation and maintenance and the working condition of the hand washing platform. So now we'll just take you through some of the hand washing platform models from different Indian states. Next slide please. So over here you can see some of the costs and the hand washing platforms. These are from the normal non-emergency scenarios. So a very simple wall mounted hand washing station with multiple points, multiple sprouts and it is connected to overhead tank also. It is, you can see the picture at the extreme left, and this will cost around 8,000 rupees. Then a simple hand wash basin near a toilet complex, it will be costing around 5,000 rupees. Then at the extreme right, you can see the fixed group hand washing platform with a cost of about 50,000 rupees. Next slide please. These are all pictures which are taken from the schools which are like existing right now, and we have taken these pictures from our different program at areas. So now you can see some pictures from Madhya Pradesh, a face-to-face peer learning kind of multiple hand washing point has been in, like it has been constructed, it has been installed in many parts of the country, and this face-to-face model actually enhances the peer group learning, and also it is relevant for enforcing the hand washing behavior when children supervise each other. And this particular model that we have from Madhya Pradesh is having the cost of near about 7,000 rupees. The model from Maharashtra is about 18,000 rupees, and at the extreme right, you have the model from Assam, which is a very simple contraption. It has a PVC pipe attached with a PVC tank, and a folded galvanized sheet is used as a drain tray. It is lodged over metallic supports just to reduce the cost and also make it very easy to assemble in areas which don't have many resources. Next slide, please. Yeah, some of the normal hand washing models that have been adopted during the COVID-19, taking into consideration all the points that I mentioned earlier. So you can see these hand washing models. which can be adopted. Like some of the models, because in these pictures you see children also, whereas schools are under lockdown. These are pictures from normal scenario, but during the post COVID-19 period, they will be very relevant with the adequate physical distancing thing. So I'm displaying, we are displaying these slides here just to highlight the fact that it's not very costly intervention about hand washing with soap, whereas it can save a lot of resources of the schools and the community members in terms of resources which get lost due to the sickness. So we have different models over here, and like all these models are very well used in the field, and these are all pictures from the field, not very complicated to assemble. So the model on the extreme right from UP that you see here is simply a PVC tank which is fitted with the nozzles for water outlet, and it won't be very difficult for a plumber in a village area to simply put this contraption in place. And now with the COVID-19, post COVID-19 school reopening, this model can be readapted for that. Next slide, please. Yeah, so this is one hand washing model which can be like very quickly assembled. It's a picture from Sarguja Sarguja district in Chhattisgarh. It's a bamboo structure based group hand washing, and bamboo, as we all know, is not very difficult to find in majority of rural areas in India. And you can see a PVC tank and a pipe of white color, like a PVC pipe is fitted into that, and this PVC pipe has perforations at the desired look intervals. So with the COVID-19 scenario, we can have a distancing of like minimum 1 meter or ideally 2 meters. And then near these perforations, children can stand, and once the children are there, then the tap nozzle can be opened from the PVC pipe so that water starts coming out of the perforations and children start washing hands. So the cost can be reduced in many ways, and these are very innovative things which sometimes community also devises on their own. Next slide, please. So another model from Chhattisgarh, only from the Balrampur district. Here you can see that the discarded tires are there, which are like very colorfully painted, and it is having a clay pot which is put in the gap in between the tire in the central area, and these things are placed below the tap, which are like connected to sometimes cemented water tank also. And beneath these clay pots, we have this drainage. So it's a very easy contraption. It can be set up ideally in any kind of rural setting, and also in urban settings, because low income settings, because these days we are also having the problem where a lot of schools and also community toilets, near the community toilets, we are having to deal with the concept with the influx of migrants who are like given temporary shelters. So these kind of hand washing stations can be easily installed in such location. Next slide, please. Next slide, please. Yeah, so this tippy tap model, lot of you might be aware. So in Madhya Pradesh, this has been used, and in many location, and this is one of the lowest priced ones. It is just costing rupees 300, and sometimes it may not even cost that much if the bamboo stick and the jerry can, all those things can be utilized out of the waste discarded from the household. Next slide, please. Next slide. Yeah. Yeah, this is one hand washing station from West Bengal, which has been like this. It has been put up in the COVID response scenario. It is costing around 17,000 rupees. Next slide, please. Can we have the next slide? Yeah, from Assam, this is one hand washing, foot operated hand washing station. It was like this model was actually, it was from a defense forces setting, but then it was later on like adapted in many states, and it is sourced from the latest COVID hand washing station booklet, which has been developed by the UNICEF team. And this is costing as little as 13,500 rupees. Next slide, please. Yeah, so again from Chhattisgarh, from a very remote tribal dominated district, you can see this model. Bamboo structure, like which is generally used for vending items, food items and other things in rural market, that has been creatively adapted, and you can see a pedal operated water outlet. A big water container is hanging above the hand washing pot, and there is a foot operated contraption attached beneath that. So children and adults can put their foot there and they can easily operate this water point, and it can be a hands-free kind of a hand washing model, very easy to put in place, and also it prevents people against the hand washing contact. Next slide, please. Can we have the next slide? Hello?
Yeah, Dr. Pratibha, I have it on.
This is one of the last slides that I'm having. This is a model by a well-known brand which produces plastic furniture and all. So Neil Kamal has come up with this hand washing station design, and these are actually from the ashram shalas, from the residential school for tribal students in very remote areas, where this model has been put up, and it's very new. It allows for physical distancing between children also, and there is a hands-free like a minimum touch kind of a model in like which can be enforced when this kind of models are put in place. Also, one thing to be considered is that when resources are available with the school authorities, also with the CSR partners and the government authorities, and they quickly need to source these kind of supplies, then it is very essential that we should have a compendium or a list of corporate or industries which are able to produce this kind of hand washing stations in a very short duration of time. So Neil Kamal has been very proactively associated with this kind of endeavors. Next slide, please. Yeah, next slide, please. Yeah, so these are some of the references from where you can find the various models of the hand washing platforms also, and also some of the key messages, like how you can enforce the hygiene message behavior in the children, like how the practice of hand washing can be inculcated in children and how it can be sustained. So all the list of resources are there, and I really hope that you will be very forthcoming in actually using some of the recommendations that we have in this presentation, and also I'll welcome any further questions after the after this webinar also, so that we can provide all the essential support. And with this, I conclude my presentation, and all thanks to ASCI team and other panelists. Thank you so much, and participants as well.
Thank you so much, Dr. Pratibha, for sharing such relevant, practical experiences from the field. So we have models ranging from rupees 300 to 17,000. We have models which are applicable in the rural areas, urban areas, settings where there is a water scarcity. So thank you very much. There are a lot of members in the participants who are raising their hand. I request my team members to see how we can address that, but the best way would be for you to just put your question in the chat box so that we can take them in after the next presentation. So quickly, for those of you who joined a little late, this PPT will be shared. Webinar is being recorded. It will be shared, and please use panelists and participants option in the chat box. So now we'll go to the next presentation. So we'll look at, after the Indian experiences, we'll look at some of the global experiences. I request Dr. Bella to please make a presentation.
Yes. Can you hear me?
Yeah, perfect.
Yeah. Okay. Yes, I'm Bella Monzo, working for the GIZ Fit for School program in Asia, and being also advising from GIZ headquarters in Germany. So please, next slide. I will be running fast through it because we're already pretty much forward in the time. Please, next slide. I cannot see the next slide.
The SDG targets? Yeah.
Yeah, I don't see. For me, it's still the same slide. The entrance slide. Is it hanging? Ah, okay. Yes, here on this slide, you can see the Sustainable Development Goals, and we have the huge opportunity that the Sustainable Development Goals have specific indicators for wash in schools. And there are indicators for the area of drinking water, for the area of sanitation, and for the area of hand washing. And each school should provide access to hand washing, and that's a part with an indicator in the SDGs. And this is very good because you can align also the the support from development partners. This is the tool, let's say, an infographic on how school or washing schools is functioning. And yet you can see you have interventions in the middle, but in order to be able to really have that these interventions can happen like hand washing, you would need infrastructure, which you can see at the bottom. You need functional infrastructure, you need the stakeholders.
Dr. Bella, we are losing you to the network.
Alone will not make it happen that children will wash their hands. That is a very essential thing. You need management in people. Next slide, please. Next slide. Yes, here you can see different, and I will just brief now, one back. You will just see brief hand washing facilities. I will browse through that because this is a global a global movement to get schools to hand washing. And on the slide before, you could see that there was one hand washing facility and a huge crowd of children, and that will never happen. If you have not the right ratio, it will not be possible to really assure that all children will wash hands. So in the year 2030, all children should be able to do that, and schools should provide that. That's within the SDGs. Important is that it is effective and that it is efficient, and that of course the emerging need for group hand washing facilities which can really accommodate hand washing for all children, specifically as a part of pandemic preparedness and response. Next slide. I cannot see the next slide. Next slide, can you do that?
Do you see the
okay.
SARS and
Just see that from the past. In the Philippines, we had the experience with SARS and H1N1 that hit Asia in 2005. And the answer of the Department of Education at that time was to really release policies and guidelines. And schools started to build up facilities on their own. Very similar what the situation we have now. And you can see very simple hand washing facilities, just tippy-tap, and every school can just do that by themselves, but also up to hand washing stations with taps or just PVC pipes with punch pipe with little holes where water is coming out. Next slide. Next slide. Yeah. And there are always common problems with hand washing facilities when they're done on community level. Very often taps get easily broken or stolen. Very often you have high water consumption, specifically if you cannot close the taps individually. If you have the punch pipe, you really have to assure total group hand washing and an aligned activity so that all children will wet their hands at the same time, lather at the same time, and then rinse at the same time, because it easily happens that the water is running all the time during the hand washing process. Very often you have low quality of construction, short service, lifespan, or sometimes also unavailability of skilled labor, limited construction in the school. And I will show you a few models from different parts of the world. Just show the next slide. I cannot see it here. Can you do the next slide? Is it in? Ah, yeah, here you see, these are cemented basins, and you can see this is a picture from Mali and another one from Fiji. And you can see very often the basins, a lot of money goes into building the basins with a lot of cement, but the core of a hand washing facility is the pipe where the water is coming. And you can also see that far too wide. Very often kids have even problems in reaching to the taps. Next slide. Next slide. Here you can see this is originally a hand washing, a foot washing facility in a school in Indonesia, but it was originally for prior to going to the mosque, and it's now used also for hand washing, and it functions well. Next slide, but of course very, very expensive. Next slide. I just browse you through that. You can fast click through these slides. I think we have seen a lot. Here you see another model from India with metal basins, and another one from Afghanistan with metal basins. Next slide. Just browse through that. you can see very often a lot of emphasis goes into building the basins. Here you can see also a group hand washing facility, which is just over a flower bed, or this can also be with gravel, and you can manually fill it. So it is, or this one is with a pipe, but if the water pressure is not enough, you can manually fill it. This is a very common solution from Cambodia. Next slide. Just browse through. You can just click fast. I can adjust. Again here, gravel bed and very, very long hand washing stations. But again, you have to open them, and for all children, it's exactly the same thing. They all have to wet their hands, and the lathering water is running. So you will really have a high water bill afterwards. That's the big disadvantage of these punch pipe solutions. Next slide. Here again, a lot of money goes into beautifully built basins, but of course it's very expensive, and yeah, it's functioning well and looks well. Next, but not really essential. Yeah, the basins are expensive, not really essential. So for more and more, the demand was coming up with a prefabricated group washing facility which is durable, which is independent from pipe water supply, low cost, and minimizes water consumption. That was a very, very important demand, and can be prefabricated, and the community can install it. Next slide, please. And here you see the Washalot 3.0, where you have an outlet which comes from the agri-business, which is often used for feeding animals, and it's available all over the world. You have 10 individual outlets, and there are legs made out of stainless steel. You can install them in cement, or you can also, like the other model, have them movable. You can place them from one place to the other. Next slide. And you can see, here's an infographic. This is in just to see you can attach it to a pipe system or can also fill it in with water. Next slide. And you can also, on the next slide, you will fast see, you can also adjust it for social distancing, just close two of a certain amount of outlets so that you can control the social distance. Next slide. Okay, all of this is, a lot of models are done in this group hand washing facility. I think you already have it in your references, and you get a very detailed construction and costing and bill of quantity for all of the facilities you've seen above. Next slide. And for the group and for the Washalot 3.0, we can send, or there's a link for downloading all construction details as well. One last aspect, I will briefly touch that. We looked into hardware, but the entire part of software, the institutional aspect, the school-based management aspect is of utmost importance as well. Next slide. Because a hand washing facility alone will not work. The school principal is globally the main actor, because he's managing the running or the administration and also the school-based management on the spot. So he has really to show his leadership skills. He has to see that resources are there, that they mobilize resources, and that aspects of wash in schools are integrated in all the plans, and that resources are available, and that teachers are carrying out hand washing, and that it's checked on a regular basis. So all that is the most important part. Next slide. And there's also a lot to read about. And I think India has done great with the system you have shown before on the dashboard, what's really being managed. So the take-home message for that is regular hand washing with soap needs functioning facilities and water and soap. All children need to wash hands with minimal water consumption. The optimal ratio is not more than 10 children for one water outlet. Just to have that in mind. The group hand washing facilities can be as cheap as less than $10 up to $2,000 per group hand washing facility, totally depending on the situation on the ground. The daily needs for children should be roughly calculated as 5 liters of water per child for washing and cleaning, and roughly a gram of soap which is 2 to 3 times of washing. But in times of pandemic and corona, like now, we might think about 5 times of hand washing. So you need to increase that number. If you use the wash a lot with this really intermediate hand washing, you only need 125 milliliters of water. And if you have conventional water outlets or usual taps with normal water flow, you might need up to 1.4 liters of water. With that, I will close and thank for your attention.
Thank you so much, Dr. Bella. I'm sure the participants are taking notes. And we thought earlier we had planned that we'll have the interaction at the very end. But I think because we are covering so many models, there might be some questions. So for all the participants who have burning questions regarding infrastructure, please send it on the chat room. These are some questions that we had received from participants at the time of registration. So I've just put them in the slide here. One is in terms of water scarce situations, what could be some essential models? I think that we have just looked at during the presentation, and our panelists have incorporated, ensured that they've answered your question. And the other is in terms of hand washing in low cost and touch-free situations. I think that's also sort of handled. But now I'd request Dr. Priyanka, my colleague, to who's been looking at the chat room very carefully. And Dr. Priyanka, any questions for our panelists, Dr. Bella and Dr. Pratibha, that you think should be answered at this point of time with regard to infrastructure?
Yes, ma'am. Good evening, all. First of all, I would like to thank everyone and all the participants for sending us questions through chat and through mail. So I won't take much time, and we will quickly move on to very interesting questions which we are getting in the chat room. And mainly the questions are revolving around behavior change and operation maintenance. So first, I would like to take up a question from Mr. Ranjit. So I would request Dr. Pratibha to take this one up. So he wants to know a facility, how the hand washing in schools can be made suitable for children, especially if it's foot operated. So how can we ensure the social distancing, and how do you think this is a good, as far as operation maintenance is concerned, is this a good model to install in the schools? The foot controlled operated hand washing stations?
Yeah, thank you. Very interesting question actually, and a very valid one. So first thing I would say that pedal operated model, you may have seen pedal operated dustbins widely used in households and in community centers. So I would say this is as easy and as difficult as that only. It is nothing very specific in design. And one of the last slides that I was showing from Chhattisgarh, in fact, very young age children were there who were washing hands with soap. So, and they were using the pedal operated hand washing station. One thing to be noted about the pedal operated station is that the pedal operated station is actually foot operated, and people normally wear some kind of footwear, children and also adults. So generally the footwear comes in contact with the pedal and not the skin of the person. So chances of transmission are very much reduced. And as far as you are talking about the operation and maintenance, I would say that in case of any kind of hand washing facility, even if it is a very simple wall mounted hand washing facility, operation and maintenance is the key. So either the school administration has to be very proactive, the Bal Sansad or the child cabinet, whichever is present in the school, has to be very proactive to keep on monitoring these hand washing platforms, and they should have that kind of maintenance support. Like they should be in touch with the plumbers and the masons in that area who know how to retrofit these facilities, who know the operation maintenance part of it. Over. Thanks.
Dr. Pratibha, just a related question. I step in right now. There are quite a few asked. What is the cost of Neel Kamal facility? You presented at the end design.
Yeah.
So what
So
is the
it is
approximate?
15,000 Indian rupees.
Okay.
15,000.
There's one more question to Dr. Bella. You showed one visual which has a flower bed as well as the gravel bed. So questions are related to, can the soap water be used on plants? Number one. And washing hands in the gravel bed, will it make it very stinky?
Yeah, thank you for the question. This is a very relevant question. We tested there because you need very little amount of water, and we've never, when there are flowers, we've never experienced that the flowers had any problems with the soapy water. So it was never an issue. So flowers were still blooming, and there was no problem with this. Even really used as intended to be used. And I've also not experienced the stinkiness of the gravel bed, but perhaps that is a lot depending on the other local circumstances. So, but it showed to be working pretty well. So we've not heard, and we've used that in hundreds and thousands of schools. So I think that has not been shown to be a real issue. We never came up as a concern. Thanks for that question.
Question to both of you. Colleague from Africa asked, they have severe shortage of water. Now this hand washing, repeated hand washing can create a water crisis. So do you recommend, are there any models with sensors, water sensors, which are cost effective but can save water?
I would say in that case that the little outlet which you can touch with the back of your hand in the washer lot is something that is basically similar to the function of a sensor, because it's just really, the water is just flowing and very slowly flowing when you touch the outlet with your hand. You can do it also with the back of your hand. And that is the same amount of water which you would use from a sensor. So it functions like a sensor, but is very low tech and available all over. But the idea is the same with a sensor. But a sensor is expensive and very often not also vandalism prone.
Over to you, Dr. Priyanka. Some more questions.
Yes, sir. There's one more very interesting question from Miss Pragati. She wants views from all the panelists here. So her question is like, why can't we provide hand sanitizers or hand rub bottles, which are like easy to carry to every student? So this will be less expensive and infrastructure won't be required. And also the chances of contamination, as there will be zero contact, will be not there. So she wanted more thoughts to be shared on this from all the panelists. So can we start with Dr. Bella, please? Ma'am, you will have to unmute yourself.
Sorry, my line was a bit chopped. Can you just put it again? Sorry, briefly.
Yes. So we have a question like, can we provide hand sanitizer or hand rub bottles to every students, as these are easy to carry and easy to fill and can be refilled by the parents. So no infrastructure is required, plus it will be less expensive. So participant wanted thoughts, your thoughts on this. Thank you.
Hand sanitizers, basically schools should provide hand washing facilities, and hand washing is much prior and higher quality and better and removing more germs than hand sanitizers. Hand sanitizers are a second or even third solution. So not to be, it's not as good for your hands. It is not good for the environment if you use it very often, but of course, if hand washing is not possible, then hands are the next step, but it's not prior to hand washing.
So Dr. Bella is of the opinion that hand washing is any day better, it's safer, and also environmentally as well as from health point of view. Sanitizers are not repeatedly recommended, hence our recommendation is to go for hand washing with soap, and then sanitizer is the second or the third option. Dr. Pratibha, any thoughts on this from your side?
Hello. Yes.
Any
So
any
about
thoughts?
hand sanitizer, in fact, there are so many different kinds of hand sanitizers, in fact, available after the coronavirus outbreak, that there is, I would say, practically a lack of authorized certification, whether the hand wash sanitizers are actually meeting the requirements. Like they should be 70% isopropyl alcohol, but not many people will be aware about this. So one thing is about the quality of hand sanitizer, whether it is really effective or not. Second thing is that that should not be treated as the overall solution. So like Dr. Bella was saying, that hand washing is a far more superior option. But yes, in case we are people are traveling or people don't have access to a hand washing platform, and people actually children or even adults need to wash hand, in such a scenario I would say that definitely a hand sanitizer can be helpful in that kind of scenario. And prior to using a hand sanitizer, kindly ensure, anybody has to ensure that hands are not visibly soiled. Over.
So, Dr. Rashmi and few others are asking not the hand sanitizer, but liquid soap. Can we give liquid soap in a particular proportion to all the children rather than creating a hand washing facilities and make soap available? Is it safe to provide liquid soap in a small containment for all the child so that they can also practice at home, not only in school?
Whom do you ask?
Anyone.
Dr. Bella.
Liquid soap is more expensive than bar soap, and very often the price of bar soap is already a challenge. So liquid soap is doing the job in the same way as bar soap, but it's not superior than bar soap. So that's the reason why we mostly deal with liquid soap. But if you have good liquid soap available, why not? There's another thing which is soapy water. And soapy water is a mixture of soap and water. And there are concepts that you wet your hand with soapy water, do the lathering, and move over to a place where there is a hand washing station to rinse. So that might, if you want to wash with huge amount of children, might easy the process. So wetten and forming the lather with soapy water and then moving over for rinsing to another hand washing. Just to accommodate.
So thank you, Dr. Bella, Dr. Pratibha, for this very insightful and thought-provoking presentation and taking all these questions. There are many, many questions, some of them saying, can we have sensor-based hand wash taps? Dr. Rashmi Bajpai is very concerned about soaps being there and people taking them away. But we also have many innovators in the group, like Mr. Ravi Senji, Jeff is there with the Happy Tap model. I think this is an opportunity for us where, because of this sharing of information, one can start looking at coming up with new innovative models. There are questions about Tippy Tap, and I'm happy that people are trying to inquire who are the manufacturers. But I think the models that were shared by both the members tell us very clearly that these can be made by the schools themselves as well, if they wish to. But there is also tremendous scope. There is a market for these products, and there's an open invitation to all the innovators to look into it and please connect with us. There are a lot of questions. We're unable to take them now. We will have to move on, but we will be addressing and we will be asking our panelists to respond to each of them, and we will come back to you on that. So moving on, we will go with the next bit of the presentation. Priyanka, with your permission.
Yes, ma'am.
All right. So the next speaker is Mr. Nilyapan, and Mr. Nilyapan has a very difficult task of explaining to us government's perspective because something that comes as a must do for all the citizens, we still are facing challenges. So Mr. Nellithan, over to you, and please tell us how the stakeholders can work with the government and support the government in achieving this objective.
Good afternoon, everyone. I am from the state of Nagaland, which is the northeast India. Here in the government sector, mostly we have two difficulties. The first one is majority of the government schools have very poor infrastructure. So because of this infrastructure difficulties, the school heads develop a mindset when we do not have the better infrastructure, it's not necessary to give importance to wash facilities. And secondly, we have scarcity of water. Of course, being a hilly station, we get plenty of water, but we don't have facilities to store the water, what we get from the rain. So this aspect is completely neglected. Now, how can we solve it? Most of the shortcomings can be managed by the school leaders, the head of the institution. From the government side, we give them yearly school grants. For example, if a school has more than 1,000 enrollments, we give them 1 lakh rupees per year. If the enrollment is from 500 to 900, we give them 75,000. So in that way, we give annual school grants, but we do not specify how they utilize it. It is according to the school head. So what the school heads can do is, they can make proper planning and use a good percentage of this school grant given for wash facilities. And secondly, from the government sector, they need to make use of the community involvement. Wherever the schools are performing well from the government sector, we have seen that the community contribution is more. So because of the community support, the shortcomings can be managed. See, if you see the data here, particularly in my state, nearly 20% of the elementary schools and 32% of the secondary schools only have the 3 wash facilities. So it's all, most of the shortcomings can be resolved by the school heads with the involvement of community. They need to make community to take ownership of the school. So by mobilizing funds from the corporate sectors and the well-wishers, the simple models which we have been displayed now can be made and we can make use of it. So in my opinion and in my experience, where the school leaders are dynamic and have concern for their children, they are able to do it with the help of the community. Thank you.
So Nellithan, you had also stated that support of NGOs and society and CSR contributions is something which is key to support government in its agenda. So would you have any models to discuss or suggestions as to how do the NGOs, because even in the chat we saw many members are saying we would like to donate soaps. What is the official channel for us to do it? We would like to take up behavior change programs. Whom do we contact? So if someone has to do this, say in Nagaland, whom should they contact? Whom should they reach out to?
Initially, for the whole state of Nagaland, they can contact the Directorate of School Education. And here I am coordinating those activities in my capacity as nodal officer for the WASH project. So the well-wishers, we can coordinate, and in which district they want to contribute their assistance. So with that, deputy commissioners, that district collectors, we will tie up. So in that way, we can make use of their assistance. And particularly in every district, at least we have 10 to 20 schools. So if initially not all the schools, we can take the help of the well-wishers for at least five schools in each district, mainly for the initial investment. Thank you.
Right. Thank you so much. So with that,
And
we'll go to the next step of today's discussion, which is that how do stakeholders from corporates and philanthropists, what can they do in this? How can they support this program? So over to you, Professor Chan.
Thank you, Dr. Malini. In fact, Dr. Bella and Dr. Pratibha have actually shared some fantastic, innovative solutions, very practical, experiences. And also, I was reading the chat. A lot of delegates have come up with very, very innovative practices. I think the challenge before us is how do we scale this whole innovation across the country? We are talking about, in your presentation, you mentioned about 1.5 million schools and there's about 250 million children. So in the next couple of months and in the couple of, probably even less than years, but couple of months, how do we really make these facilities available to all the children all the time so that, they achieve this hygiene practices? So I think this is going to be a big challenge is innovation. From innovation, how do you achieve the scale is a big challenge. And that's where I have a couple of ideas for the consideration of the audience and as also like-minded people who have joined this particular group. First and the foremost one, in my view, is washing hands with soap. Currently, the conversation that we are having in the context of COVID should not become an emergency response. It's not just an emergency response. Right now we have a crisis, so let's wash hands and let's promote infrastructure and let's promote CSR interventions and other government responses. I think it should become a right. Washing hands with soap and access to hygiene should become a right, like the way we have right for education, we have right for information, we have right for clean air. We should also have every child in all these schools should have right to hygiene, particularly hand washing with soap. So this is the first and the foremost thing. As a collective, we should actually push for this agenda. Swachh Bharat, Swachh Vidyalaya program has provision for it. I think we need to amplify this. And this is a message for all the NGO partners as well as the development part. I think it should become not a COVID response, but it should become a fundamental change. That's number one. Number two, in order to achieve the scale that we are talking about, I think we need phenomenal amount of innovation. The current model of brick and mortar and procurements that we have is not going to get us the response that we need, the quickness that we need. We need a lot of creativity and we need a lot of innovation. And that's where we need to bring in corporate sector innovation. We need to bring in CSR. We have to bring in philanthropy. And that's what I'm going to talk about. I'll give you a couple of examples how this scale was achieved by the CSR interventions, by the corporates. We heard about 108, which is an emergency response system, which started in Hyderabad as a CSR for providing emergency service to accident victims and other emergency responses. In a shortest possible time, this 108 facility has been scaled up to the state, and now it's part of the whole national. You go to any state and nook and corner, 108 or similar emergency response system has been scaled up. The similar example now we keep hearing about is a Akshay Patra model. Akshay Patra is a common kitchen and then delivering midday meal scheme. I think that's a scale we need to look at it. So in the current context of hand washing with soap, we need actually Akshay Patra like models, Akshay Patra like entities to manufacture soap, to produce soap at a very cheaper price and deliver it to all the schools that we are talking about. I think we need that franchisee model. We need these innovations both from the NGO sector as well as from the corporate sector. So corporate sector can play a very, very catalytic role in bringing these innovations and help governments to scale up. This is one example you can see on the screen, our own experience. We started with an idea of exclusive toilets for women in a city called Warangal, and now it got scaled up to all the towns, municipalities in Telangana, and it's also getting scaled up as a part of the national. Next slide. We started with another interesting idea through CSR intervention. Priyanka, next slide.
Put the next one.
So we have started this exercise, a small CSR intervention to treat the fecal waste collected from septic tank, which is very, very nasty and is contaminating our water. Now, as part of the CSR, we started a facility called fecal sludge treatment plant in a town called Narsapur. It got scaled up to all the 100+ cities in Andhra Pradesh. So I think the CSR can become a very powerful catalytic change, not only for infrastructure, but also for behavior change. In fact, if you see a lot of advertising agencies, a lot of partners are available with a lot of creative skills. I think we need to bring corporate social responsibility, not only to create infrastructure, but also to communicate and also create a new practice of hand washing with soap, not only in school, but also going back to the house. Many participants have asked a question, okay, we are providing all these facilities. What happens if the child goes back to the house and the household may not have the right kind of infrastructure, right kind of facilities? So it should become a norm. The children should influence the parents. So I think there's a lot of behavior change, communication can come as part of this CSR. It's not expensive. In fact, Dr. Bella mentioned about 1 gram of soap per child for 2 washings. And I did a back of the envelope calculation. And if you see for the whole country, per annum, it costs not more than 1,200 crores. 1,200 crores for 700+ districts, 250 million children. In fact, it's a very, very tiny investment. It's a tiny investment which we can pool together as part of the CSR. What we need is a common understanding. We need a common agenda. Instead of going all over, all the CSR firms doing all sorts of things, I think there is a need for greater alignment for a single cause. That is right to hygiene. Right to hygiene as a fundamental right, like the way right to information has become a norm. Right to hygiene also should become a norm. And corporates can play a very, very fundamental and game-changing role in coming together with innovative solutions. Look at Akshay Patra. Akshay Patra model is actually providing food for migrants and many other workers who got stranded. The same kitchen, which was actually providing food for children, now actually the same model is actually being used by the governments to provide food during the times of COVID. That's what CSR investment should be doing and can do. So I think as a collective, again, I would urge that I think we need to work together and bring this, this CSR investments for a common goal rather than going in all sorts of directions and making all sorts of investments. Thank you very much.
So, Professor Chari, you're urging all the corporates and philanthropists to take that additional step.
Absolutely. And, look at this visual. I didn't touch upon. This visual is a good example. What CSR should do is put together those 2 steps. The core infrastructure actually has come from the government, but if you don't have those 2 steps, the infrastructure will become dysfunctional. This is what I mean by catalytic investment. And CSR, these are not big corporates, small corporates, institutions, and also some of the non-profits also can be doing some of these issues, small issues. Rotary is a great example. They're doing fantastic work in actually giving new ideas to the governments and to the development partners. So I think we need more such players into this space so that in the next 3 months, we can actually cover all the schools in the country.
Thank you, Professor Chari. I'm sure the corporates and philanthropists are find a direction, and they were already motivated. That's why they're here, that they find a direction as well. I'll quickly go over to the next presentation, and the last presentation of the day is from Professor Harsh. Professor Harsh is the director of SIPS, as I mentioned. So Professor Harsh, before you start, one question is that given that government is keen, given that other stakeholders such as corporates, philanthropists are keen, how can your organization and in partnership with ASCI, how can we extend this and achieve the objective? Over to you, Dr. Harsh.
Yeah, thank you, Dr. Malini. This particular issue, in fact, I would just like to briefly go back to what Professor Chari was talking about, that hand washing and hygiene in present context not to be seen as something that it's only an emergency response. And I know that Center for Urban Governance in ASCI is working on this particular issue for pretty long. Now, SIPS is an institution which has been created by Government of India primarily to promote innovations in public systems. And we are supposed to look for those innovations and identify and document those innovations, and also look towards replicating those innovative practices in public systems. So if you look at it, our mandate itself is that the things need to be scaled up. It should not remain just a kind of a prototype and which has been used in some particular place, and it doesn't lead to a kind of desired outcomes and results. So Center for Innovation in Public Systems, which is an autonomous center of Administrative Staff College of India, is actually the only institution in India as of now whose primary mandate is to look for innovations in public system and then look for that how they can be replicated by bringing various stakeholders together. So some of the work which we have done, it is there on this particular slide. We primarily work in urban governance, education, health, and e-governance, and we have developed databases, conducted workshops, and we have also done detailed process documentation. Now, this is something which is important, which I would like to put to Professor Chari and Dr. Malini and all other present here, is that if you are trying to replicate an innovation which has been successful in some particular place, it is important that it has to be properly documented, not only in terms of a case study, but in terms of a process, that how it can possibly be replicated. And that is not an easy job. So it has, so in another place, you need not to reinvent the wheel. You know what are your resources, you know what are the technical specifications, you know from where you can get material and all those kind of things which are there. So we are doing this particular activity, and we would be very much keen that many of the innovations which have been successful, both in terms of technical solutions and also in terms of behavioral change aspect, we can document them, and if there are willing stakeholders, we can come together and try to replicate those things. Please go to the next slide. Next slide, please. Yeah. So what SIPS can do and what Administrative Staff College Partnership can do for fast-tracking implementation of hand wash stations in school is, we can help in approach to central and state government departments and agencies. We have got a network which can facilitate this particular thing. We are willing to conduct knowledge events with stakeholders like this one, and the kind of participation we have today has been very heartening. We can assist in developing process manuals and helping in replication. That is something which is our mandate. We are also looking at, in fact, we are discussing with Center for Urban Governance, Dr. Chari and Dr. Malini, to launch online programs for relevant stakeholders, where both asynchronous mode and there can be some live elements also which can help in various stakeholders to come on the same platform. And at the end of it, it's about facilitating conversation among all the stakeholders. So SIPS is ready to facilitate this particular conversation and ready to invest our human resources and all of the resources in this particular effort. So if you have any ideas and other things, you are most welcome to approach us. Thank you very much.
Thank you so much, Dr. Harsh. So we are now at 4:30. That's when we are supposed to close the webinar, but uh, if there is enough interest, we would like to extend this webinar for some time so that we can have interaction, can take some of the questions which have come in the chat room. So officially the webinar is over, but we'd like to continue this. I request all the members to stay on so that we can take some questions. I would first start with the questions that have sent to us during the process of registration. So this is with regard to operation and maintenance, and the questions that some of the members have asked is, in the Indian context, how do we build cost-effective and low maintenance models? I think this was addressed by the earlier members, but some thoughts on operation and maintenance. And if I can throw this open to all the panelists, whoever would like to respond, that what are some of the best operation and maintenance models that one has come across, whether it is in terms of financial models or processes or standard operating practices established by governments across the world. So I'll throw this question open to the panelists, anyone who would like to respond. Dr. Bella,
Yeah.
thanks.
I mean, only I think, thank you very much, all the colleagues. I think it's very important. And at the end of the day, it's very much establishing a culture of cleanliness in the community and in the school community. Most important when it comes to operation and maintenance is really coming up with clear costs, that you are aware of what is the cost for example, cleaning the facilities, how much soap do you need, what do you need to get it running, to keep it running and to clean it. And on the other hand, really come up with standard operating procedures, what has to be cleaned, how often, and really coming up with sort of checklists per school, which people have to check that they did this, so that proper really a monitoring can be done. Only what gets monitored gets done. And I think something like this, coming up with checklists and as possible, make them as simple as possible that they can really be managed. I think that's important.
Thank you, Dr. Helen. The next question, a set of questions revolved around behavior change, a very important topic. And in fact, I think this topic deserves a completely different webinar dedicated to it. But still, because people have asked and it is an important component, how can we ensure that this hand washing practice, this is a similar questions that they used to hear about toilet also, because many times in government schools, children who are coming are the first users of toilets. So when they go back home, they may not have access. So how do you ensure this practice continues? So the same lines, even if a school manages to ensure that everybody washes their hand prior to having a meal, how do they ensure that this practice becomes an inherent part of one's behavior, whether it's home or outside? And also if children as agents of change can take this message further to the community members as their siblings, family, and community at large. So would any of the panelists like to share their thoughts on this? Dr. Pratibha, any thoughts on this from your side and behavior change interventions?
Yeah, perhaps.
Yeah. Yes, Dr. Bella, please.
Yes, one. I think it's the most important, I think, from my experience, is really establishing routines. And as schools are organized around routines, I think schools are very well suited to start behavior change, because they're organized around routines, hand washing at the same time, regardless of if rain or shine. So that routines will be happening prior to eating. We will all wash our hands. That's a routine, and bring that in as part of daily school life. At the same time, at the same spot, only then they will develop a habit. So a habit needs to be really done without any thinking, and that needs to develop a routine. And I think that's something very important, that it has to do with things happening always in the same manner at the same time. This is what a school is very well suited to establish that.
There's this question about ownership amongst school administrators, and essentially a lot of pressure, I would say, is placed on headmasters and headmistresses that if they want, they can make things happen, and that was reinforced by Mr. Nelyathan as well. So, if we are looking at bringing the innovation culture in education per se, but specifically to wash and washing hands, what would be some of the good approaches that we take to bring this innovation culture, with encouraging schools to try something on their own rather than wait for this heavy infrastructure investment, wait for it to come from the government, that Dr. Bella has also reinforced that point over and over again. So what would be some of the measures to bring this innovation culture? I'd like to hear from Dr. Harsh also, because you're working on that. How can we bring this culture?
Can you hear me?
Yes, Dr. Harsh.
Yeah, and this issue of culture actually is extremely important, as we have seen in the Swachh Bharat mission also. And it has to start, the cycle has to start probably at the school. It will not probably start at the family level. And from there, it has to go to the family, because children, they are, as being seen in many other contexts also, they are really ready to adapt to new things much better compared to other elder people. So it has to start at schools, and for that, I think teachers and everybody who's involved in school administration has to take a lead. So any kind of a sensitization awareness or any kind of program which has to be there, it has to target those people. So the cycle can be that from teachers, from school administrator, or whomsoever is guiding children in the school, from them it goes to the children, and from children it goes to the wider society. So it is extremely important that we focus on teachers and other people whom students come into touch with. It's not really an easy thing. In fact, according to me, creating a technical solution is probably easier compared to bringing in behavioral change, because people have all kinds of excuses and all kinds of other issues are there. However, this is possible.
Dr. Harsh, I have one more question for you since you're there, and I think Dr. Bella wants to say something. I'll come back to you, Dr. Bella. Yeah. But I have one challenge for you, or our friend Jeff, the inventor of Happy Taps. He would like to know how he can sell 1 crore units in India. So would you be able to help him?
Hey, can you please repeat?
A friend, Jeff Revel, who has a Happy Taps model, which you can see on the screen. Okay. He would like to know how he can sell 1 crore units of this in India. How can he scale up? Would SIPS be able to help him?
SIPS can help him. You see, the scouting part is over now. So we know that there is we have identified an innovation. Now the issue is that we have to document, and we have to convince state governments, because that is how we deal with. So we have to convince state governments to give this particular model a chance compared to, say, any other kind of a model. So we can help, but the process is going to be that we have to go through state governments. We have to convince the relevant authorities and bureaucrats that, okay, this is something which is better than other institutions. And then probably if that works out, then we can obviously can have some initial replication at some of the identified schools, and then it can work out.
Fantastic. And this goes out to all the other innovators also who have joined, and many of them, Mr. Ravi Senji and many others, that we are here through ASCI and through SIPS to help in identify opportunities and promote innovation. So please do connect with us, and we'll be happy to take this forward. Dr. Bella, you were giggling. You had something to say, or okay? Okay, great. So then we had to. Yeah, go on, Ben.
Ma'am, there's one more question for Mr. Niliyappan. So can we take that up?
Yes, ma'am.
Yeah, sure.
Sir, actually, there are many questions which are coming in the chat box related to funding and SOPs, as it is extremely challenging for the government also to provide masks and everything, for all the provisions for the schools. So many participants wanted to know that can panchayat and school development funds be used for providing hand washing stations, masks and other provisions to the students along with their families, because it is also challenging to get this habit into their parents.
Yes,
So
yes, ma'am.
for the safety of the students in school as well as home, so is government taking any steps or any kind of SOPs being issued? So can you put some light on this, sir?
Yeah, hello.
Yes,
Yeah,
yes, ma'am.
Pratibha this side. Can I
Yes.
respond to that?
Yes, ma'am, please.
Yeah, yesterday only we have received a directive from the government of UP. So they have requested like all the districts, they have in fact instructed them to use the Gram Panchayat based funding, which is the Finance Commission funding, for putting up hand washing stations in schools that can be used by communities also, and also when the schools are reopening, there they can be used. So it's like definitely a very valid point that there's a perpetual shortage of resources for construction of new facilities in school. But then if we start looking out innovatively for solutions, we'll find the solution. And as Dr. Nailappa was also telling when he was presenting, that the more the communities are involved in the upkeep and maintenance of school, and the more communities feel that it is their school, it is meant for their children, they will be able to come up with innovative solution. And hand washing station is not something highly cost intensive. The lowest cost model can be tippy tap also. So it's just about having the willingness, and then the way will always be there. Over. Thanks.
Thank you, ma'am.
Ma'am, Madam Pratibha has answered the questions, but just let me, I would like to compliment her one. When Dr. Malini asked me to take part in this one, at that time only the education department, we realized that what are the challenges are being in front of the department. So immediately we started collecting accurate data of the number of hand washing stations available in each school and the enrollment of the students. So the data is now with us. We are working on it, and the department also plan to make some special incentives. I mean, special some financial packages. We do not know about the exact how much we will be able to give, but the department is working out to keep some specific amount, particularly for these wash facilities. Thank you.
Hello. Yeah, Pratibha, this side. Just one small point I would like to add here. Hello.
Yes, ma'am.
Yes,
Yeah. You see, these issues like operation maintenance of wash facilities in school, the construction of new hand washing units in school, is a two-way beneficial process. So on one hand, it is safeguarding health of children and the students and all teachers also who are in the school. At the other hand, they also provide a livelihood option. These days, there are like across the world issues related to migrants are happening in India. Now since day before yesterday, various states are going to make efforts to bring back the state migrants who are working in other states of India. So once these migrants return home, they will need some livelihood opportunity, because these migrants have lost their livelihood in cities, and they are like just like they have lost everything because of the coronavirus pandemic. So once they are back in the villages, they can be utilized for construction purposes, like they can be used as construction laborers and they can receive some monetary compensation for their work. So it's a livelihood opportunity as well as it will safeguard the health. Over from my side. Thanks.
So, Priyanka, do you have any questions that from the audience that we can take up?
Yes, ma'am. Ma'am, there's one more question that is for Dr. Pratibha. So there is a thought, people want to know like what is the, for a specific design, what you had showed, ma'am, the bamboo hand washing station.
Yeah.
So how many hand wash it can support? Like what is the capacity for it to withstand the water supply? And
Okay.
also one more question, is there any alternative for foot paddle to elbow design? Do we have anything available in which fits the Indian context and especially at this time?
Yeah. So to respond to the first question, like which is about the first part of the question, Priyanka, can I have it
It was,
once?
yes, ma'am. It was regarding the bamboo design what you shown.
Yeah. It will, you know, it will have to be seen locally. Like I can't say that a particular length of bamboo will support these many clay pots and that many number of like galvanized sheet it can support. So it's not that that kind of estimation is not there, but definitely we have the design and I have the itemized cost wise breakup for all these hand washing designs. It is
Okay.
provided in the last slide on references. So there's a guideline that we have developed during COVID-19 and this guideline provides item wise cost estimate. So you will come to know how much length of iron pipe or bamboo for how many water points and all that. So that estimation is there.
Okay.
And second part of the question is like, yeah, can you share it
And
again?
second part of the question is, do we, instead of foot paddle design what we showed, is
Yeah.
there any elbow operated design?
Yeah. So, you know, elbow operated hand wash, this thing, the water faucets are very much available in the market. And
Okay.
these are in fact mandatory in the healthcare centers. But during COVID-19, given the lockdown time and also given the fact that very few plumber shops are open, very few hardware shops are open, and also the fact that transportation of essential goods is also very much difficult these days. So the point remains about its availability in the market. So if somebody is interested in construction and installation of a hand washing facility and they start thinking that we have to get a elbow operated water faucet only, that might lead to difficulties. So that's why we are talking of this pedal operated model. Over.
Okay.
Just a related question. Many of the members in the participant members are asking if the designs that were shared by Dr. Bella and Dr. Pratibha today cater to the needs of children with special needs, or do we need to make any design changes? So any quick responses on that?
Yeah, I think that is something to see what kind of limitation or limited mobility is there. I think that a lot of hand washing stations we have shown there, if they're low enough, they will also catering to children with limited mobilities. And I think that's something to really check on each of. It's most important that the basins are not too wide and that the outlets are not too high. So that is of utmost importance. And if they use crutches, where they can place them in order to stand stable. So I think that is important, but it should be something locally looked at what fits where and what kind of facilities. They should always, when they think about which design they look for, have that in mind. It's important to keep the view on children with limited mobilities in your view, in your design, when you do it, see that also through that lens. And specifically, don't think you only need a ramp or whatever. If the rest of the school ground is
Exactly.
with full of stones, a ramp is nothing, because course, there will not be any child in a wheelchair because a wheelchair cannot move on school ground. So have these things in mind when surrounding, look in which location are you do something, and keep in mind what is the situation of children with limited mobility, and see that that will be addressed as well. There's no one fits all solution, but it's important that we keep that into our thinking.
Yeah. Thanks, Dr. Bella. I would like to just add one more point. In the Indian context, the Department of Drinking Water Sanitation and UNICEF had collaborated to come up with a school sanitation hygiene education guidelines which is inclusive in nature. So it considers children with special needs or disabilities, and this guideline is like very much available online. It is also on my last slide, where I have given the list of references. So people can, like a lot of questions, you're right, they have been in the chat box. People too can refer to that last slide, and they can find this SSHE guidance document. It gives all the designs and modifications for hand washing stations, and also the toilet facilities, and also the school infrastructure in general, like Dr. Bella mentioned. So people can refer to that. Thanks.
Ma'am, I would like to, sorry.
Yeah, one question, because Professor Chari dropped off and came back, because that was the question that I asked Dr. Harsh also to respond. Professor Chari, there are a lot of questions by innovators among the attendees, that how can, there's some request that ASCI should organize an exhibition of these innovative models so that schools and governments can come and review them. But apart from that, there are many innovators and they're sharing their ideas. How can we, going forward, promote these innovations and reach it to the different state governments for wider spread, along with the documentation that has already been done by UNICEF and GIZ and others?
So I think there's a lot of material already is compiled by UNICEF and GIZ, and a lot of individuals have come forward to share. So I think the question is about organizing this whole material, and we can disseminate through multiple channels. But equally important is to take it to all the state governments and reach out to them. That's number one. I think SIPS and ASCI are well positioned to disseminate this information. But I think equally important is to share this information with all the corporates who are actually interested in this space. So I think we need to organize, anyway, we have a plan to organize roundtables with corporates where this information will be shared, and they will be sort of nudged to invest in this space so that hygiene becomes a right and becomes a practice in our country. So I think there are two approaches. It's also a question which Mr. Manoj was asking in the chat box. What next? What is that we're going to do with all this? I think number one is disseminate this information to as many people as possible so that there's no information gap, number one. Number two is to raise resources, create pilots, and create opportunities for innovators to sort of scale up very, very fast. I think ASCI and SIPS, and with partners, development partners like UNICEF and GIZ and a number of other partners, I think we have a responsibility to showcase this, what we have discussed, in each and every state and with each and every corporate house. And that's the way forward in my view.
Thank you, sir. Priyanka, over to you.
One last question which came up regarding the retrofitting designs. So I would like Dr. Pratibha to respond for this. Do we have any techniques, or are we talking about designs also where we don't have to spend and we can just kind of minimize the cost for building new hand washing stations? So do we have any available information on this, Dr. Pratibha?
Yeah. So, like very appropriate question. You see, wherever there are existing hand washing stations, there's no need to construct new ones in the context of COVID-19 outbreak. What is needed is that some of the water points can be sealed permanently or removed, so that the minimum distance of 1 or 2 meters can be ensured between two children when they stand there to wash their hands. So that kind of retrofitting can be done. And even some people in the chat box had put the suggestion that bamboo barriers can be put in between children and all to prevent contact and physical distancing. So even those options can be explored. Over.
Can I also request Dr. Bella to add on this, as one of your pictures had those sealed outlets, especially in this COVID. Ma'am, you will have to unmute yourself.
Yeah, I think in this special situation of COVID-19, we would have, there's much more movement, there's much more attention to go for hand washing stations, specifically looking into what can be done not to touchless, or what can be done to really address pandemic preparedness and response. But we've also to stay sort of pragmatic, what is possible in the long run, what will stay, what will keep there, what can be afford, and see that you get the best out of it. I think at the moment, it's of utmost importance to look what you have, to make an assessment on school level, each and every school, make an assessment what you have, and look for the options, look for partners, and improve the situation. And that is, I think India has done great when it comes to assessing the situation on school ground. You were the first to have really huge data available on the status of wash in schools. These are the pieces which will be very helpful now to assess what is the need on individual school level, what needs to be done, and then how to, in the COVID situation, how to improve it to be in line, or to address also, or to take into account the specific requirements. So they're not so easy to reach all the specific requirements, what schools have to do right now in order to be ready to reopen again, but also keep that and use this hand washing wave which is coming, and keep that as schools need that in the long run. It's so important. I was so happy for the words Professor Shari was pointing out, saying this is not just now, this is something we need always. And you have the wonderful midday meal, and the entry point for hand. India is a country to really show for grading routines of hand washing, and must scale. So I think all the tools are in your hands, and you have great examples from all over. So that would be my words to that. I have high respect for what I see in India.
Thank you. I think it's touching 5 p.m. now, so we should conclude. Any concluding remarks by any of the panelists are welcome. And we thank all the attendees for staying on for half an hour longer. So, any concluding remarks?
Madam,
Dr. Pratibha? Yes, sir.
From my side, special thanks to all the panelists, particularly Dr. Pratibha and Dr. Bella. We would definitely be stealing your ideas since your slides will be with us. So we are just waiting for the schools to open, and we will get ready with some of the best models. Many models are best, and it could definitely be used in hilly states, particularly those things with bamboo and other things. So I came here for taking something, and I'm going back with many things in my hands. Special thanks to Dr. Malini and team for giving this opportunity. And thank you everyone for all the participants. Have a good day.
Thank you, Mr. Niliyappan. You've been very brave in joining us in this. This I've been mentioning from the beginning. As a government representative, you've taken a leadership role, and we look forward to collectively support you and ensuring that we help Nagaland as a state reach that all children have hand wash facilities with soap within the next 2-3 months with your support.
Thank you, ma'am. Thank you so much. Thank you
Any
on behalf of all children from Nagaland.
Thank you. Any other comments from the panelists? Dr. Harsh, Dr. Pratibha, any comments?
So,
Mr. Chari?
Many participants asked for creating a network
So I think the responsibility is on you and us as a team to
Yeah.
create a network of all these attendees and beyond, and keep
Yeah.
sharing information, because it has to become viral. This whole movement that what Dr. Pratibha and Dr. Bella shared with us, I think it has to go viral through multiple channels, not only through government, not only through corporates, but also through other partners. So I think please create a network either through WhatsApp or any other, so that this momentum can be sustained and people can ask questions when they hit any roadblock in they want some new ideas, new advisories. I think it's a great opportunity to propagate this idea. Thank you very much.
Thank you so much, sir. We'll look into this. Definitely, we've received requests. We are just on the lookout for a lesser non-intrusive medium than WhatsApp. So that there's less disturbance and it's more proactive information seeking. So we are working on it, and we will reach out to all the participants. And on the screen again, the website and email ID are there for any of the participants to reach out to us for any information. Happy to share whatever we can and
Only
we have.
one quick point. A couple of international participants have shared their ideas during the chat. They have also shared the link. So I think we should share those documents with our Indian audience very quickly.
Yes, sir. Absolutely. We have the download of the entire chat. It take a couple of days to put that together and share that information with everybody else. Dr. Harsh, any comments from your side so that we can conclude the program?
Just, I would like to thank everybody. It was a very great learning experience for me personally also. And SIPS would be interested that this journey continues. This webinar is only a starting step. And we would be willing to support within our mandate, so that, as Professor Chari says, that this particular initiative actually goes viral, because that is the need of the hour. We just cannot do things as they used to be earlier. So I'm very thankful to everybody, and especially Professor Chari and Dr. Malini for inviting me and considering us for association. Thank you very much. Probably we will. Yeah. Thank you.
Thank you very much. I just wish we had used some other word apart from viral, given the COVID situation that we are in right now. But yes, we get the intent, and we hope this becomes a moment, a national movement in all the countries in the world. So thank you once again to all the participants. We'll close the program now, but we have formed a community of practice, and we'll be in touch with you